Welcome to the intersection of city politics and everyday life. I'm Brian Lehrer. Today, at Thanksgiving, in the City of Plenty, we address a crisis of hunger and nutrition. It's a crisis because 1.4 million New Yorkers are relying on a patchwork of emergency food programs across the 5 boroughs. 200,000 more people than 5 years ago. And a report just released by the Food Bank for New York City finds that more than half of our food pantries and soup kitchens do not have sufficient food to serve everyone in need. How come food insecurity is increasing and obesity and diabetes remain at about the same high levels despite the efforts of the Bloomberg and de Blasio administrations? Before we meet our experts, let's watch a couple of minutes from a Politics of Food conference held last Thursday. It was organized by the media company City and State New York. One of the first issues raised was the Trump administration's proposed cutback of SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps.
It's thrilling to be at a conference named The Politics of Food, because too many Americans allow themselves the false comfort that food or hunger aren't political issues. The reason we're the only industrialized Western nation on the planet with a large hunger problem is the failure of our political system. The president has proposed $192 billion in cuts to SNAP. $1 billion cuts to SNAP. Larger cuts than even proposed by President Reagan. And so you understand the consequences of what this means on the local level. So a $700 million reduction. And you combine you and the great work of City Harvest and all the, over 1,000 pantries and kitchens in the city, the federal cuts just dwarf what all the amazing charities in New York can put together. So that's the present.
But I think the other thing just to keep in mind is that there are people who have been appointed to jobs. We have a new USDA secretary, and they're already sort of rolling back changes that were made to sort of make sure that the food industry doesn't compromise the public's health. And it's really the industry pushing back. And so they've already started to roll back anything that has Michelle Obama's name on it, certainly.
Yes, things are not swell in D.C., but real change always happens locally. Mm-hmm. The reality is that there have been horrible things that have come down the pipeline from this administration and the last, and New York has benefited from the fact that our leadership has always stepped in.
We're really looking for what are the things that can have the greatest impact, how will they impact the health of New Yorkers, are they feasible and enforceable, and public opinion is not always in sync with what may be the most impactful. So we've seen that with tobacco. If we look at how unpopular the Smoke-Free Air Act when it was first passed was, public opinion followed. It's now incredibly popular. It was replicated worldwide. And we see similar, even if we think of trans fats, it's now seen as a success. It's now nationally coming into effect. That's what government's responsibility is. And public opinion will follow if you can make the case for it.
A snapshot of the City and State Food Conference last week. Which public policies have helped address health and hunger in the past decade? What more can be done? Joining us, Dr. Melony Samuels, founder and executive director of the Bedford-Stuyvesant Campaign Against Hunger. The Bed-Stuy campaign not only provides 3 million meals a year to New Yorkers, but has programs in nutrition, gardening, cooking, and it helps people connect with services, get their tax refunds, and more. Joining us, too, is Manhattan City Council member Ben Kallos, who cares about food issues, especially in the schools. His district includes the Upper East Side, East Harlem, Midtown, Murray Hill, and Roosevelt Island. And here as well, Nick Freudenberg, professor at CUNY's School of Public Health and Health Policy. The Urban Food Policy Institute that he directs has just released a guide explaining exactly how food policy gets made in New York. Welcome, all of you. Thank you very much for coming in. Dr. Samuels, let me start with you. What's the fall 2017 report from Bedford-Stuyvesant, and how does it compare to a year ago or to 5 years ago?
Well, Brian, thank you for having me. And I'll say that when we look at the comparison, there's been a vast increase of families that are hungry, that needs food. And we also look at the resources that have been dwindling down. Now, presently, we're finding it's far more difficult to keep food on the shelf, but also to get food onto the shelves. And this is really a concern. Example, This is Thanksgiving, and already we have served over 44,000 individuals this month only. And so that means that all the resources that we have mustered up that we're expecting to last us until a few months ahead, we have already used, and now we're looking at some real empty shelves coming up. So that's
Bedford-Stuyvesant is a gentrifying neighborhood. Is that relevant or irrelevant to the numbers you just gave me?
It is. It is a wonderful, Bedford-Stuyvesant is a wonderful place. A lot of stores opening, a lot of restaurants, apartments, but then you look at the fact that apartments have skyrocketed in prices. Now you're talking about, when it used to be $1,200 for a 3-bedroom, now you're talking $3,000, $4,000 depending on who you're talking to. And so what it has done, it has pushed individuals out of their homes. And when you push individuals out of their homes, you're forcing them either into a shelter or to compromise their living condition. And compromise meaning that instead of a family of 4 living in a three-bedroom home, you have 3 families living in a 3-bedroom home. And so there it is, the need, it is obvious. And I don't know if anyone is noticing, but a lot of storage facilities have been placed in very poor neighborhoods, and I'll tell you why. What is happening is that families have been forced out of their homes. They cannot utilize their regular furniture, so they have to store it. So now they're paying storage costs plus rent, and so that's why the pantry lines are growing. That's why we're seeing this month alone almost 800 new families.
Councilman Kallos, is City Council aware of this, and is it something that needs to be addressed at the level of food policy or housing policy or a combination?
It's a big problem from federal, state, down to city. And I have to say, it's not even just a problem for Bedford-Stuyvesant. We're seeing it on the Upper East Side, which some might say is more affluent. Mm-hmm. And so at the food pantries and the soup kitchens in my district, we're seeing a change in demographics. So we're not only seeing folks who are street homeless or coming from shelters, but now we're starting to see a lot more seniors, families on fixed income, where they're feeling that pinch of housing and just looking to cover costs and get the additional food they need so that they aren't hungry. And our food pantries, our faith-based institutions, their shelves are starting to empty out, and folks are just digging in deeper into their pockets and into their congregations for additional support. And going into this year, we secured $18.4 million through the City Council, led by Councilmember Steve Levin, Councilmember Barry Grudenchik, and at the time we needed $22 million. Coming into this year, we're looking to the mayor and the executive budget to fill whatever gap we might see from the billions of dollars in cuts that we're expecting at the federal level, and then just addressing some of the need that we're hearing about today.
Can you, Professor Freudenberg, talk about the cuts at the federal level? Are they real cuts, or are they only hoped for cuts by the Republicans? The health care bill that would have turned Medicaid into a block grant program, for example, did not pass.
That's right. But I think we need to look at the totality of the really radical Trump agenda. And I think the biggest threats have not yet been implemented. There's a plan that the Speaker of the House, Ryan, has proposed to block grant the food stamp program, SNAP. And we know from the block granting of public assistance that that led to significant cuts. And if that happens, what would be the situation with SNAP is it wouldn't be able to expand as our economy deteriorated, as we saw in 2007. The economic recession was a very big threat to nutritional well-being in New York and the nation. And by block granting SNAP, by giving a fixed amount and saying no matter what the circumstances, no matter how many people were poor, no matter how many people were out of work, it would be the same dollars that were available. That's a very big threat. But I think there's another side to the food problem that we're facing here in New York City, and that is that for too many New Yorkers, not only the too many people who are food insecure, but for others as well, healthy food is getting more expensive, and unhealthy food, food high in fat, salt, and sugar, the very ingredients that are associated with our epidemics of diet-related disease, diabetes, obesity, heart disease, hypertension, some forms of cancer, it's much easier to get unhealthy food in many of our communities than healthy food. And we need to be looking at policies that will really make healthy choices, easy choices in all our city's neighborhoods.
And we'll come back in a few minutes to some proposals that I know you're working on, Councilman, with respect to school and food in that respect. But let's stay on food stamps for a minute. Dr. Samuels, the Republicans who push block grants and other cuts say, look, there was a real spike in food stamp use in this country after the 2008 financial crisis started. And that was part of the Recovery Act, and there was a lot more need all of a sudden starting in 2008 than there was before that. But the spending didn't really come down even as the needs started to come down as the economy recovered. So that a cut in food stamps is actually a rational thing now, not a mean slice at the lives of the poor.
So as Nick alluded to about the new proposed interest where SNAP is concerned, what we have to remember is that when Sandy came about, it was not that anyone was prepared for a hurricane, but yet there was such great need for DSNAP. And so when you are—
That's the emergency food stamps,
right,
the
that's
DSNAP.
Right, yes, and so when you put a limit on SNAP in that way, what we're doing is that we're not prepared for any kind of disaster, and you're not prepared for any kind of disaster, where even unemployment or anything.
Because a block grant is a fixed amount.
It's a fixed amount.
It doesn't have that
right.
accordion flexibility to go with need like the current program.
Right.
But if I can add one thing about the recession, I think the impact of the recession is some people have started to do better, and including some people in New York City, and that's wonderful. But there's a very large group of low-wage workers, and increasingly SNAP is supporting low-wage workers. So when McDonald's and Walmart pay the minimum wage or less, those families are eligible for SNAP. And so it's really taxpayers are subsidizing low-wage employers to pay their workers less than they need to feed themselves, and then SNAP is picking that up. So increasing the minimum wage is a way for addressing food insecurity and reducing the number of people who need SNAP. And the efforts to increase the minimum wage in New York, California, and some other states are important steps in the right direction. And sometimes economic policy contributes to food policy. You know, having people have more money in their pocket, having housing be more affordable, that allows people to spend more on food. If we want to reduce the number of people who depend on SNAP, then we need to make it easier for them to find affordable housing, affordable health care, and work that pays a living wage.
Councilman, go ahead, Dr. Samuels.
No, I was just going to say, with the trend that's going on right now, we don't see housing becoming affordable. With all the gentrification that is happening in our neighborhood, we have to wake up and look. And who is suffering is our poor families. And I'm seeing it daily, and with the income so low and getting SNAP, and you also have to remember those that don't get SNAP because maybe they're $5 working too much, and they still cannot afford. And so that's where food pantries such as Bed-Stuy Campaign Against Hunger comes in. That's where the increase is coming in. And I look at this, and we have to really bear in mind that, and I mentioned earlier on today, that there's a need for collaboration efforts. If we're going to have affordable housing, we really have to have true affordable housing. If we're talking about living wages, then everyone has to participate, whether you are Walmart or not. Everyone has to come on board in order for this to work. And so there has to be understanding overall in our city that if we're going to really hit poverty head on, we must work together, and there must be agreement and to impact families.
And I think just one of the other challenges we see in the city is just under-enrollment, that there are affordable housing programs out there for seniors and disabled, but it's really hard to learn about them unless you're hooked into a food pantry like yours. That's actually why we're working on legislation called automatic benefits, which is once government or a food pantry or somebody knows about financial need, why do you have to apply for an earned income tax credit and then go back to that same government and ask for SNAP, and then go back to that same government and ask for a senior citizen rent increase exemption, and then go back to that same government, and there's 40 or so different benefits. And so legislation that has already been heard and we're hoping to pass by the end of the year would say, once you apply for one benefit, we're going to take all that information and find out if you can qualify for 40 other benefits. And I guess one of my strategies is, I think we're going to have to fight, but I believe block grants is something that they're going to try to get to eventually. And my goal is to try to run up the numbers in New York City, where I think it's about 75% of those who qualify get SNAP, and in my district, 94% of the seniors who are eligible for SNAP don't get it.
That's a victory. Oh, don't get it.
Don't get it.
Don't get it. Seniors don't know sometimes, right? People who were, say, formerly middle class, and now they're in their retirement years, not earning an income.
Right, or there's stigma.
There's a lot of stigma.
Some people feel that they don't deserve it, or that that the barriers are too great.
And they believe the returns are just too small. At times they're still under the belief that it's $10, and it makes no sense for me to make an effort.
What is it?
It's far more depending on
your income
and your pension. One
victory at the other end of the age range that you've been involved with is school lunches, right?
Absolutely. So we have 1.1 million public school students, and I major in psychology. I believe in Maslow's hierarchy of needs, which says that you can provide to people's resources and they self-actualize. And so my goal has just been that if we're going to have a public school system where we're actually getting kids on an even footing, then we shouldn't have one group of kids not worrying about their food and another that they really just don't know where their next meal is coming from. And so we started off and we rolled out pilot programs in middle school, and we kept fighting for universal school lunch. This year, after we saw victories at the middle school level and other levels, we've rolled it out for high schools. And then on top of that, I've introduced legislation that asks the city to report on how many of the kids are actually participating, and a little bit around some of the food quality issues, because I've been to every public school in my district, and there are some salad bars that you might think you'd have to pay for, but you don't. And there are some salad bars where the salad is coming out of a can, and that's a problem for me.
Do you have a personal story along these lines, do I understand?
Absolutely. So I grew up on the Upper East Side, and I grew up in a single-parent household, a single mom, and also a multi-generational household, which for viewers at home, that may seem normal in most neighborhoods. That's not something that you see typically on the Upper East Side. And I went to high school in the Bronx, Bronx Science, and when I was going there with the other kids from the Upper East Side, the other kids would go out and buy lunch, and I wanted to be friends with them, and they were not eating at the cafeteria, even though I had my reduced school lunch there. And so I would just skip lunch, go hang out with the other kids who are buying lunch, and tell them I wasn't hungry, because the truth is I was starving, and I just didn't want to get picked on like the other kids who did get picked on.
Stigma.
Right. Yes.
And if I can add from a public health perspective, school food is just such a wonderful intervention. So first of all, there have been big improvements in the nutritional quality of school food in the last decade. Still a lot further to go, but big improvements. So children get healthier food. It both helps to reduce food insecurity. It also reduces obesity, because the children who eat in school aren't going to the corner store to buy soda and candy. They're filling their stomach with healthy, nutritious food. There's good research evidence that kids who aren't hungry learn better and are likely to do better in school. For the family, it means that they don't have to spend money on sending a lunch to school, and that they have that money for food at home and for health care and for other necessities of life. So it's the kind of city program that can really benefit people. New York City serves 245 million meals and snacks a year in 11 different agencies: daycare centers, senior centers, hospitals, jails. And that's a really important way to improve the health, to address both food insecurity and diet-related disease. And we ought to be looking, just as you were saying, Councilmember Kallos, to enroll the maximum number of people in each of those 11 different programs that serve city food to people.
But even as school lunches get healthier and everything else you were just saying, aren't the stats that there's really no difference in the childhood obesity and diabetes rates than 10 years ago?
Yes, I think the overall rates of both adult and child obesity, actually at the youngest children, there are some advances. But a big problem with all the diet-related conditions is those advances don't benefit every population group equally. And the better off and white people are benefiting more than low-income and Black and Hispanic populations. And that means we really need to think through how to make these programs more available and what else to do. And the sad thing about food is there's not one thing you can do. You need to do 10 things. Yes. Improving school food, improving SNAP and making it easier to enroll. And particularly, and I hope we get to talk a little bit about unhealthy food and reducing the promotion of unhealthy food in the city.
And we will, but that multidisciplinary approach that's so needed is exactly why the Bed-Stuy campaign against hunger provides so many different services, right?
So we provide approximately 290 nutrition workshops, and it's effective. There's work being done. We are seeing success. It might not yet be recorded, and it's going to take some time to see overall to see what's going on in our community. But when we look at some of our individuals that we have been working with, we're seeing definite changes. I just had a woman that ran maybe 3 weeks ago, a senior, straight from the doctor. She ran straight to our facility, out of breath. What's going on? What's happening? Oh, I lost 20 pounds, and now my medication is different. I'm almost there. So there are individuals that we're seeing some positive effect, changes in their lifestyle and how they're eating, and they're taking it serious. It takes a lot of work. We are persistent. We have incorporated our urban farm with our nutrition program, which is really helping. It is there as a teaching tool. So I believe that we will definitely see changes. It's education, talking about the advertisements that are out there with the unhealthy food and how do we combat that. But we are seeing some definite changes. For instance, we do this class that we call Stomp Out Obesity. And to start the class, we give every child $2 and say, okay, go to the corner store and buy your favorite snack. They go in and they come back with their sweet drinks and everything else that it's not healthy. At the end of the class, after 6 weeks of working with them, we give them $2 again and say, go back and buy the snack you want without following the child or anything. And they come back, 85% came back with a healthier snack. So the work is
acclimate
right
to whatever it is you used to eat.
Right. So there's a bit of a change, but we have a lot of work left to be done.
Let me ask you, Councilman, about the change of administration, which is now more than 4 years old, or about 4 years old, from Bloomberg, who was the public health mayor, that was one of his things, to de Blasio, who's the inequality mayor. Has he continued Bloomberg programs? Does he take nutrition, staying on this topic of unhealthy versus healthy food, does he take it as seriously or does he approach it in different ways?
I think that Bloomberg got the conversation started, and whether it's the Smoke-Free Air Act and getting smoking out of our parks and whatnot, to going as far as the soda ban where he faced substantial pushback, I'm incredibly grateful to this mayor for universal school lunch. I'm incredibly
to this mayor.
This mayor. I'm also incredibly grateful to this mayor for breakfast after the bell, getting to class, getting to school before the bell. To have breakfast wasn't something every kid was getting, and at this point now we have 2 meals covered. I hope to continue to push the mayor, who's huge on wraparound schools, community learning schools, and if we're doing community learning schools, I think we can do supper, and there's still federal dollars for that, and I want to get to a place where 1.1 million children have 3 square meals a day, and I think it fits in with what the mayor's been doing. He did the sodium labeling,
yes,
and I'm hoping that we're able to move forward a little bit, as our other guests have been alluding to, which is something we've been working on, which is healthy Happy Meals, which is just setting caloric and other health standards around meals for children.
Healthy Happy Meals. It sounds like McDonald's, except the healthy part.
That's correct.
Well, I'd like to hear you on de Blasio versus Bloomberg. You've looked at this, right?
Yes, yes. We just put out a report looking at how city policy around food has been made over the last decade. And we're putting out a second report in January looking at the impact of that. And I think both Mayors Bloomberg and de Blasio made two different but really important contributions to food policy. I think what Mayor Bloomberg showed us is that the city government already has the power and the authority and the resources to bring about changes in food policy and food environments. And through the trans fat ban and through the standards for food served in city institutions, and through the Green Carts program, and which puts fruit and vegetable carts in low-income communities, the Fresh program, which provides incentive to supermarkets, he showed how city government can lead to healthier food environments. And I think what Mayor de Blasio has done is really highlighted the recognition that our food problems are really poverty problems, are really inequality problems. And by establishing universal pre-kindergarten, by working on affordable housing, by developing workforce programs, and by continuing some of the Bloomberg initiatives, he's shown a path to beginning to take on these inequalities. But the more disturbing feature is that despite all we've done around food, as you mentioned earlier, neither our obesity rates nor the diabetes rates have gone down. So we need to be taking some very hard looks in the mayor's office, in the city council, among academics, among community organizations, of what do we need to do so that 10 years from now we'll be able to say, well, we brought obesity down, we brought diabetes down. There are fewer hungry people in New York now than there were 5 years ago or 10 years ago. And we need to do not just a few more things, we really need to think about transforming our approach to food policy if we're going to be in a better place 5 or 10 years from now.
Is it possible that making the changes that you've all talked about here today that have been made so far just need more time to work, or do there need to be additional policies, Dr. Samuels?
I think additional policies are necessary. But then I look at 2009, when we started out 1998, but at 2009 we recognized something that no one else recognized. When I said this to many of the larger food banks, they thought I was making stories up. I recognized that families were not, the pre-packed bags were not working. Families were giving things that were unhealthy to their related illness, and made a change, gave a choice. We started the first supermarket choice pantry in Brooklyn, and we have helped so many other pantries since then to take on the same format. The format is different, it works. Once someone needs a pantry, it is good to have choices. Healthy vegetables, more vegetables are given to every family that walks in. Grain, no sugar.
I've seen the one on 116th Street in Manhattan.
Yes.
Where you shop,
yes,
and you have a certain number of points to spend.
Right.
And the healthier foods are fewer points.
Right, that's correct. So the work has begun. It's going to take time, but of course the policies are needed. The recognition of what's happening in our city is needed to be recognized and then worked on.
And that has to be the last word for today. Thank you all very much for coming in. Happy Thanksgiving to all of you and your families, and to all of you. And that's our program for today. We are here each week, midweek at this hour, at the dodgy intersection of city politics and everyday life. After this conversation, I will give a special thanks for my meal tomorrow. I'm Brian Lehrer. Thanks for watching.